Good morning, everybody. I'm State Senator Henry Martin, and we're here to speak to the House bill that's before the Health Committee this morning, and that's regarding the workplace abuse and violence that's taken place at our healthcare facilities. I, like many, have long held the belief that hospitals are a safe place to receive any type of healthcare treatment. Places where you go for emergency care, a scheduled surgery, labor and delivery services, diagnostic testing, and lab services and patient education. An environment one goes to for treatment and to be healed. This past fall, I learned that hospitals were not so safe places. Me and a few of the Senate Republican office staff members met with Nancy LaMonica, Vice President and Chief Nursing Officer of Bristol Hospital, and with over 20 nurses, doctors, security personnel of Bristol Hospital Emergency Department staff. We learned one of the most difficult problems of facing healthcare professionals is that they are experiencing verbal and physical abuse from patients, their family members, and patient friends. You'll hear shortly real-life stories and much more in the personal and written testimony today. Studies have shown that healthcare workers, especially nurses, are up to 16 times more likely to be subject to workplace violence than other workers in other occupations. Another study found that almost 90% of all healthcare worker population was exposed to violence. In recent years, there has been a spike in the verbal and physical attacks on hospital staff. The abuse needs to stop. There should be zero tolerance for any type of hostility toward healthcare workers. And the public needs to know any acts of threats or violent behavior will not be tolerated in any healthcare facility. Today, HB 6741 asks this of our legislators, to provide the Department of Health. We're asking the Department of Public Health to develop a marketing plan to deliver public service announcements regarding mistreatment of healthcare providers. That is, civility is expected by the patient and family members. Second, it establishes a grant program for hospitals to fortify their facilities. And lastly, allows hospitals to establish policies and procedures that would provide hospitals the ability to require non-emergency patient to leave the facility if any patient, any family member of the patient or friends of the patient conducts threats to the safety of others. So with that, I'd like to ask Senator Heather Summers to come up and say a few words.
Thank you, and good morning, everyone. My name is Senator Heather Summers, and I am the former chair and ranking member of the Public Health Committee. I'd like to thank Senator Martin for bringing this bill to the Public Health Committee. It has bipartisan support. We will be hearing it today in the Public Health Committee. So I hope if you're listening, you can tune in to hear what our healthcare workers and others have to say about what's transpiring in our hospitals currently. I think it's really important to recognize that our healthcare providers, and I happen to be married to one, are the essential workers. These are the people that kept us through the pandemic. They put their lives on the line. They work incredible hours under incredible stress to make sure that you and I and our loved ones are given the best care that they can in sometimes some very dire situations. It is unacceptable to have violence in the hospital setting, just as simple as that. I know that there are people that are frustrated. Sometimes they can't see their loved ones when they come to the hospital, or there's certain procedures. Maybe they don't want to wear a mask, or they can't go into a certain area. But all those constraints are done to keep us safe, and to keep those who are in the hospital safe, and to keep our essential workers safe. Everyone has the right to feel safe at their job, and that includes and most definitely should be a priority for our healthcare workers, those who are caring for others. This proposed legislation establishes, as you've heard from Senator Martin, a hospital security grant program. It permits hospitals to make policies regarding provider, staff, and patient safety that govern when a patient receiving emergency or non-emergency care can be removed from the site if their contact threatens the safety of others. It is a common sense piece of legislation, and it's sad that we actually have to pass this, but we do because of the ongoing and the increased violence that we're seeing in our hospital settings. We have seen in the recent years since the pandemic a startling spike in verbal and physical attacks on doctors, nurses, and other hospital staffs. As we saw during the pandemic, our healthcare workers provide an essential service to our public health of our communities and individuals, and it is absolutely unacceptable to stand by and allow these healthcare providers and employees to work in an abusive working environments that they suffer from the public. So now it is my pleasure now to have Dr. Jeff Gordon, who's also a senator, come up and say a few words.
Thank you, Senator Summers, and thank you, Senator Martin. I'm Jeff Gordon, State Senator for the 35th District. I'm also a doctor, past 30 years, and I'm also married to a doctor. So my wife and I understand firsthand every day, including every night in the middle of the night, what it's like to be in situations where we always have to think of situational awareness. I can tell you when I go to a hospital, and I've worked at a number of hospitals during the years, big ones, small ones, we always have to think about safety. We think about safety for our patients and for their families, but we also have to think about safety for everybody who works in a hospital, the doctors, the nurses, every staff member who's in a hospital. I wish I could say that this is a new problem. It is an old problem that unfortunately has been getting worse, especially during the years of the pandemic, and continues. And as Senator Summers said very well, people who go to a hospital, people who work in a hospital, they should be in a safe environment. Connecticut prides itself on providing some of the best medical care in this country, and we need to make certain that the men and women who provide that care, no matter what the setting in a hospital, the emergency room, an inpatient floor, in a clinic, need to be as safe as possible. And that means that we as legislators need to stand behind this bill. I support it, to do what we can do to help our hospitals keep their employees safe. And when I talk about the men and women in the hospitals, I mean everybody we need to make certain that they're safe. So I'm very proud to be here with everybody, stand in support of this bill. I'm a member of the Public Health Committee. I look forward to hearing testimony on this bill and seeing what we can do to help all the healthcare professionals in Connecticut stay safe and continue to care for everybody in this state who needs the care when they need it. Thank you.
Thank you, Senator Gordon. Senator Summers mentioned that this was bipartisan support, and yes, it is bipartisan support. Senator Anwar was scheduled to be here with us today, and at the last second, he was asked to attend the governor's press conference. So with that, I'd like to invite Carl Schissel to say a few words as well, representing the Connecticut Hospital Association. Carl?
Thank you, Senator, and good morning, everyone. And thanks to all the senators who have addressed this issue, and for those healthcare providers who are here with us today, but also on the front lines of healthcare. I wanted to open by saying a couple of things. One, since the year 2011, assaulting a healthcare worker has been a Class C felony in the state of Connecticut. That's a real crime. It's been on the books for 12 years, but we need to do more. And Senator Gordon mentioned, and I think others, about how during the pandemic, incidents of violence have increased in healthcare settings over the past several years. In hospitals alone, between 2020 and 2021, there was an increase of 28% in the number of workplace violence incidents reported to the Department of Public Health. That's unacceptable. This bill continues our efforts to make hospitals safer. I wanted to assure you that hospitals are doing everything they can to keep everybody safe who comes into their operations. And things are getting more complicated now as we push care out into outpatient clinics and even healthcare settings in people's homes. So the challenges to keep healthcare providers safe is becoming more and more complicated as we sort of endure together this challenging post-pandemic time. So here's what I like about this bill. Number one, the Department of Public Health's public awareness campaign. Many of you, when you walk into a hospital, will see a sign that says, "You're in a hospital, please be nice." When I first heard about signage in hospitals, about people being nice and showing each other mutual respect, my first reaction was, I didn't think that was necessary, because people ought to be nice to one another. But in this day and age, we're seeing less and less of that. And so hospitals are already taking steps to implement campaigns like mutual care, mutual respect, and remind the public that you're in a special protected setting where, in addition to getting you healthier, we want to make sure we keep you safe. So Section 1, which would lend the state's voice to that campaign and make it a public awareness campaign, we think is a very positive first step. Second, as hospitals are trying to make their facilities safer, we need help. And so Section 2 of the bill, which would provide a grant fund so that hospitals could draw upon state financial support to implement measures to keep their staff safer and their buildings safer for people who use them, is another important way that the state can help hospitals be safer places to be. And then finally, enabling hospitals to implement policies so we can make it clear or clearer to people that their bad behavior will not be tolerated.
Time, Nancy LaMonica, she's the chief nursing officer of Bristol Hospital, and her colleague Tiara Sheetham, who brought these horrific workplace atrocities to my attention, which led to the development of this bill.
Thank you, Henry. Good morning. My name is Nancy LaMonica, Vice President of Patient Care Services and Chief Nursing Officer at Bristol Health. I've been a nurse for over 34 years and a nurse leader for over 18. I have practiced as a clinical nurse in critical care, coronary care, the emergency care room, interventional radiology, the operating room, post-anesthesia care, telemetry, home care, and a nursing supervisor, as well as an adjunct professor for nursing students. The reason I stand before you today is to advocate for Safety of Healthcare Providers and Patients Bill, HB 6741. I share my clinical practice with you to give you a clear picture of my background and the events that follow. I might get a little emotional on this part. As you are aware, on October 12th, 2022, 2 police officers were murdered in the town of Bristol. But days following this senseless tragedy, our whole community experienced sorrow, disbelief, anxiety, anger, and fear. And my team at Bristol was shattered. Not only were many of these nurses connected to these police officers, but many had police officers in their own families. Nurses began to express concern that because of the incivility and violence they experienced daily, this could happen to them too. A sense of terror was spreading throughout the building, throughout the hospital, knowing that it could come in our hospital doors. Our battle of facing COVID and nursing shortages seemed minimal compared to this new foreseen battle, if not addressed, could lead to possible death. Soon after, a nurse and social worker at Methodist Dallas Medical Center were gunned down in the maternity ward, adding to our reality. Years ago, these violent acts at the hospital were not as common. Today, it can be an everyday or every hour occurrence on a nursing shift. As nurses, unfortunately, we have almost come to accept this abuse as part of our environment and part of our culture. I thought about my years as a nurse and how I expected it to be part of my job. Why did I think that was okay? Why had I remained complacent when it is not in my character to do so? Why didn't I see the need all along? Why did it take this tragedy? Perhaps this is why our vacancies are increasing in the healthcare profession. People are more aware of the violence that has no boundaries, on top of virus battles. Our social platforms expose people who are in professions and do not keep their oaths. However, the community perception seems to take this news a step further to say that because of that, they should be allowed to escalate and be disrespectful in our places of work. I would personally like to thank Senator Henry Martin, who met with me about my concerns, where we discussed the state of nurses and healthcare workers, vacancies, the trauma that occurred at Bristol, and violence occurring daily within hospitals. Bristol nurses and other healthcare workers were given a platform with legislators to have their voices heard about the abuse, stalking, and assault they have personally experienced. The Bristol team shared that if assault and disrespect for nurses, for healthcare, and for service industries continue, healthcare and service industries will continue to decline, and those who have taken a vow to promote healing, safety, and reducing suffering will continue to leave their professions. This type of environment is not only at Bristol Health, but at all hospitals around the state and around the nation. As part of the nursing profession, it is time for us to advocate together with one voice to lead the change for safer healthcare environments. How can we, as nurse leaders in good faith, expect others to join our teams, to fill our vacancies, and take care of our patients without taking a stand to give them a safer environment to work in? We have to do more than tracking assaults and pressing charges. You see, every nurse has a story. Just ask. We have advocated together with legislators for a safer environment for our patients, and now it's time to do the same for our nurses and for our healthcare teams and those that serve alongside us across the state and across the nation so we can continue these services. When these traumatic events happen and are over, they stay with us and they traumatize us, not just physically, but psychologically, for a very long time. By changing the rhetoric through commercials, through education, securing our entrances, and standing together in one voice, we can stop assaults and abuse and prevent our nursing team from being victimized. We thank you, and we ask you for your support for this bill so we can change the culture of nursing, to care for our patients, promote healing, and reduce suffering in the service industry we know and love called healthcare. As one, our motto needs to be, healthcare violence to zero. Thank you for your time. I'd like to introduce now Tiara Cheatham.
Hi, my name is Tiara Cheatham, and I've been a nurse for about 14 years. Thank you for the opportunity to testify in support of this bill. I have noted that there is an increasing trend in workplace violence in my time working as a nurse. Here's a little bit of a background information. So about 85% of nurses do not feel safe in their workplace. 75% of hospital staff members have been physically assaulted at least once during their careers. 25% of psychiatric nurses, which includes myself, has experienced disabling injuries due to assaults from patients. So these numbers were taken from the CDC website in 2020. Since the pandemic, these numbers have only increased. There has been more patients seeking care with less healthcare workers present to provide that care. Underreporting is also a huge concern for many healthcare providers. Many feel that this type of violence is just part of their job. Fear that reporting will reflect poorly on that nurse or healthcare provider, which is a form of victim blaming, is also a huge concern. The belief that some patients cannot or will not be held accountable is also a reason that a lot of these assaults go underreported. Personally, I've been assaulted at least 3 times in my career. I've been spit on, punched in the face, and most recently, I've been kicked in the chest. On each occasion, I did fill out a police report. After the first 2 assaults, I was informed by police that the patrons would likely not suffer any consequences. I've also had a knife pulled on me while working in home care. I've also been threatened to be raped and killed by patients. None of these assaults should be tolerated. All of the patients who have assaulted me should have been held accountable for their actions. The recent news reports have made my loved ones fearful for me while I'm at work. I am also more hypervigilant when working and out in the community for fear of being assaulted. My experiences unfortunately pale in comparison to other coworkers and friends that I know. One nurse that I've worked with was so brutally assaulted that she ended up needing surgery and was out of work for an extended period of time to recuperate. Another healthcare worker I've worked with was punched in the face multiple times by a patient. A psychiatrist that I know was assaulted by a patient that she had no interaction with. That assault has led to her being out of work for most of 2022, and she's considering not ever returning to work. So those are just a few quick stories about how assaults could affect people in healthcare. And thank you for the opportunity to share my perspective, and I strongly urge members of the committee to support this bill.
Thank you, Tiara. I hope that we shed some light on this, on the abuse, verbal and physical abuse that's taking place in our medical community and the facilities that they work in. I hope that this bill will get through the committee process and eventually onto the floor in both chambers, and then eventually signed by the governor. So with that, we will take some questions if there are any.